Stalls from a range of mental health organisations and charities were scattered round Guildhall Square. With a little help from some suitably cheerful musicians, volunteers and gazebos alike were braving the winds to tackle mental health stigma.
Well, we've got a number of events going on for World Mental Health Day. Actually, we're stretching things over a couple of weeks because we want to take as many opportunities to raise awareness about mental health, that actually it's very common for people to have a problem or issues with mental health. 1 in 4 of us at some time in our life will struggle with a mental health issue. And actually it's part of the way things are just for life. And there are stresses in life, there are reasons why people have mental health challenges and problems. And what we want to do is destigmatise this. Too many people are frightened or a little bit fearful or don't know how to react to people who are going through a mental health challenge. And so many people who have mental health problems tell us that in fact it's not so much the illness sometimes, it's other people's reactions to them that are part of what might have been a very, very difficult time for them.
The aim of the day was to get people thinking and talking about mental health, and to prove that people can recover even from very serious mental health issues and go back to work.
Employers sometimes might worry about employing somebody that's got a mental health history, not quite sure if they're going to be reliable, if they're going to turn up, if they're going to go sick all the time, are they going to be stable enough to be working? And sometimes you have to challenge that. Sometimes people have had bad experiences of employees, and also sometimes people just have stereotypes about certain diagnoses and people and what that actually might mean. I mean, I had an experience of spending a long period of time in hospital. I spent 3 years in hospital, 2 years detained under a section of the Mental Health Act, and my experience after that was it's very difficult to find employment with such a big gap in my work history that I either had to explain or apologise for. So now I'm working for Time to Change, and it's actually a role that I have because of positive discrimination. We have to have lived experience to work in this role.
Southampton is a city that suffers more than most from the issue, in part because of low incomes and the cost of housing.
We do have slightly higher numbers in the city of people with severe mental illness. That's things like schizophrenia and bipolar. Plus there's quite high numbers of people living with anxiety and depression. All those mental illnesses perhaps caused by other factors, homelessness, lack of a job or relationship breakdowns, all those things together really.
At a similar event in Bristol, volunteers spoke to over 600 people on the streets in one day. But while raising awareness is vital, events like these can only go so far in helping those suffering from serious mental health issues. Briere-Edney in Southampton for Solent News Now.